Fentanyl is a synthetic opioid 50 times stronger than heroin and 100 times stronger than morphine. Fentanyl can't be seen. It's tasteless and odorless and is found in nasal sprays, eye drops, and in other ways. It also comes in the most coveted form, a lollipop, tricking our kids. Fentanyl is extremely potent. This potency makes drugs cheaper, more powerful, more addictive, and more dangerous when added to other painkillers. Fentanyl addictive is most commonly prescribed by doctors for severe pain after surgery and for advanced stage cancer patients. Illicitly manufactured, it is found easily and readily accessible in tribal communities. This is the deadliest overdosing crisis in American history. As the #1 cause of accidental death in this country, one dose is enough to be fatal if used accidentally or improperly. Native Americans' overdose deaths are more and above the national average and are disproportionately impacted per capita wise. Drug-related activity in Indian country is a major contributor to violent crime and imposes serious health and economic hardships on tribal communities. According to Charles Addington from the Department of Interior for the Bureau of Indian Affairs, reported back in 2019, it has been our experience that most illicit drugs available throughout Indian country are not manufactured on the reservations, but rather transported into Indian country by independent dealers who travel to nearby cities and bring these drugs into tribal communities. Today, we have tribal representation from the southern to northern and central, and law enforcement and courts and organizations who are actively fighting this war against this poison that is plaguing our people. They will share their experiences through challenges and possible mitigation strategies to move us closer to a solution. We will hear from tribal chairs about fentanyl's impact on their respective communities, how this enemy impacts governance, and the challenges they face when leading with a respectful, productive, and cultural response, trying to move their people forward in this climate. We want to learn their recommendations for a stable government-to-government solution. We will hear from law enforcement and courts, from the tribes, county, and the state. We will learn how fentanyl has impacted policing and protecting some of California's most vulnerable communities, including the tribal communities. And lastly, we will hear from healthcare providers and medical center representatives on how the fentanyl climate has impacted their service, the challenges they face, and the needs they have, and what resources they need to continue to serve their population and communities. Collectively, we want to hear about their challenges and address the issues and work together as a legislature toward a solution so that we must no longer say that this poison is attacking our people. We must work to destigmatize those seeking mental health resources. We must work to break those stereotypes of those being able to reach out to seek those resources proactively. We must educate one another about the warning signs that might help us to get help to our loved ones before they turn to this poison, fentanyl. I look forward to hearing from our panelists, but before we do, I would like to acknowledge Assemblymember Matt Haney from Assembly District 17. He is the Select Committee Chair on Fentanyl, Opioid Addiction, and Overdose Prevention. Assemblymember Haney.
Thank you, Chair Ramos, and thank you so much for your leadership. When I first came to the Capitol and I met with Chair Ramos, this was the first thing that we talked about, and we spoke about the fact that our districts are very different. The communities we represent are very different. I come from inner city San Francisco. I represent and live in the Tenderloin, and Yet, for both of us, this is an epidemic and a crisis that is devastating our communities, and we desperately need to come forward with solutions. I want to recognize and thank all of the tribal leaders who are here, the law enforcement leaders, the healthcare leaders, and I especially want to acknowledge those who are with us who have lost a loved one to an overdose. This is something that is taking away our children, it's taking away our friends, it's taking away our sons and daughters, and frankly, it's something that we are not treating with the urgency and the harm that it's causing in our communities. We know that this epidemic is felt even greater and more disproportionately on tribal lands and tribal communities, and we have to confront that in partnership. I think one of the things that we get into too often in this epidemic is people say, no, we don't need to do that, we need to do this instead. No, we don't need to focus on treatment, we need to focus on enforcement. No, we don't need to do harm reduction, we need to do treatment. The reality is we need to do all of it. Nothing we are doing right now is enough or working. We have over 10,000 people in our state who are dying every year now from drug overdose. 10,000. That's a number that's doubled over the last 5 years. And frankly, if we keep doing what we're doing right now, things are only going to get worse. And there's not a vaccine for this. There's not a single solution. There's all of us working together with solutions that are at the scale of the problem that we're facing. Yes, we need more treatment. Medication-assisted treatment, getting more people onto Suboxone, buprenorphine, treatments that work, we can do that, but we have to reach people where they are. More Narcan, naloxone, everywhere that people may be at risk of overdosing, there's no excuse to not have that life-saving intervention there. And yes, we need to stop the unimpeded flow of these deadly drugs into our communities, and we need more effective enforcement to do that. And lastly, I want to say that there are solutions that are out there. There are solutions that are being pursued right now by tribal leadership and tribal communities. The clinics that folks are operating and opening, the approaches to reach people in a holistic way, in a community-driven way, those are ones that we have to support, that we have to invest in, and that we have to uplift. And I really thank the chair and all of the leaders who are here for taking the time to do that. I want to give my commitment as the new chair of this select committee on fentanyl, of which there are members who are here. Chair Ramos is also a member of that committee, to continue to follow up with the input that you all give today, the solutions that you put forward, that we draw on those for legislation, for investment. Please invite us as a committee to come and visit you all, and we have a commitment to move on from today with partnership in Chair Ramos's leadership and with all of you to confront this epidemic. It is ravaging our state, and the disproportionate impact of on tribal communities needs to be highlighted, but also the solutions that you all are pursuing also need to be uplifted. Thank you.
Thank you so much, Assembly Member Haney. We want to go through and introduce yourselves, and we'll make our way around this way. You can make some short comments if you wish.
Round table, I believe that this is really a real issue for all of us. I really appreciate your leadership. I want to thank all the support that you give to tribal community. And I think that this is the issue that we all need to work together, like tribal leader, law enforcement, and I think that all the city across the state. I believe that this issue is really, really complicated, and even the process. So this require teamwork, and I'm here to give all my support to the chair. Really want to thank you for your leadership. Thank you.
Thank you so much.
I'm Eloise Reyes. I represent the San Bernardino area, and I'm very pleased to be here. And Chairman, thank you so much for convening this roundtable. And I appreciate the comments from the chair of the Select Committee on Fentanyl. It is an issue that is affecting all of us, the entire community. I want to most especially thank those who are going to provide very personal testimony of losses. Your courage and your strength is going to provide us with a greater foundation of what it is and how serious the issue is that we need to deal with this. This isn't one person, one tribe, one ethnic group. It is all of us, and the solution has to come from all of us. And I appreciate the comments about the partnership. It is a partnership. It absolutely is a partnership. Our San Bernardino County District Attorney, in giving a speech once, Jason Anderson, said, "At the rate we are seeing it, if fentanyl poisoning hasn't affected you personally, it soon will. It's going to affect all of us. So it isn't that it's affecting that person or that group, it's affecting all of us. And if it hasn't affected you, it will affect you. And we have to be prepared to stand in partnership, because when it affects one, it affects us all." I thank you again, Chairman, for bringing this and for making sure that we as an assembly recognize how important it is and how we need to work together. Thank you.
Thank you.
Thank you, Mr. Chair. I'm Marie Waldron, Assembly Member from the 75th Assembly District in San Diego, which represents more tribal governments than any county in the nation, in fact. Back in the year 2000, I became active with the San Diego County Opioid Task Force, which at that time, it was kind of all new. We were trying to figure out what is this opioid crisis that was coming from the East Coast and moving west. And I was shocked and horrified actually to see, the results of that. And when parents would come in and bring maybe their football quarterback from high school, rolling him in a wheelchair that had been affected by an overdose, and other parents, even now as I go to speak around my district, because they know that I work in this space, their children had died of overdose, even their adult children. And a lot of the issues also, including the privacy issues that don't allow parents to even know where their adult children are in treatment, or if they are, and later to find that they're not even alive anymore because they couldn't find where they were. We have a lot of issues that we need to tackle with. The chair brought up the awareness issue, the stigma issue. Those are very big issues in bringing people into treatments. I'm honored to be a member of both this caucus as well as the Select Committee on Fentanyl. And we do have a lot of work, as was said. Native American communities have been hit especially hard. We do have the treatments that are available if we can get people in there. Naloxone continues to save countless lives at the time of overdose, giving people a second chance at life and be able to seek help and recover. So we really need to be able to get that treatment to people. One of the bills I've authored this session is AB 1233, which requires the Department of Healthcare Services to conduct outreach to each tribal government in California for the purpose of advising them on the availability of naloxone, hydrochloride, or another opioid antagonist through the Department of Healthcare Services Naloxone Distribution Project. Our hope is to get out there to make sure that every tribal government has at least some of these treatments available on site and know how to administer it. And I'm excited to hear, some of the things that are going on and what we can do and how we can improve upon it. So thank you.
Thank you so much. Senator Mathis?
Thank you to both the chairs and the prior comments. This is a plague, and it's scourging across all of our communities, all of our homes, and the comments are absolutely solid on the fact that we have to come together and that the state needs to be able to provide resources, technical assistance, but also funding and other things need to open up. And we need to make sure that the sovereignty of the tribes is also looked at as we do that, because too often the partnerships are, well, we'll do this for you if you give up just a little bit. We need to make sure that these partnerships are working hand in hand with our local sheriffs. I know in my own communities, and for those of you who don't know me, I represent Tulare, Kings, and Fresno counties, covering the Tule River tribe and the Santa Rosa Tachi tribe. And we have cartels that are running drugs, guns, and human trafficking. I know this is strictly for fentanyl, but they all tie together when it comes to what's happening to our communities. And we need to do more. The state needs to do more. The feds need to do a lot more. And we need to work hand in hand as partners to get every resource possible. So thank you all for being here. Thank you for holding this, for looking at this. But we need to do a lot more than just sit around and talk about it. And I appreciate the legislation moving forward. But we need to put some teeth into what we're doing so we can actually put a stop to it. Thank you.
Thank you.
Good morning, Pilar Chiavo. I represent Assembly District 40, which is the North San Fernando Valley and Santa Clarita Valley and Castaic. And I just want to thank the chairs for bringing this forward and looking forward to hearing from folks today. I have to apologize in advance because I'm also technically in another committee at this moment. So I'll have to be stepping out at a certain point. But you know, as someone who's worked on healthcare policy for the better part of, you know, more than a decade, as a nurse advocate and someone who actually got my start working for a tribe in Oregon, when I got out of college, I saw really the important role that tribes play in the really unique way that they ensure that they approach issues in the community, and that it has to be something that really comes out of you know, the culture, and that cultural understanding is critical to making sure that there can be appropriate solutions to challenges that we're facing. And, you know, as has been said already today, fentanyl is ravaging our state throughout our communities, and I know Native communities especially hard hit on this. And so, you know, looking forward to ways that we can support tribal communities in addressing this, you know, public health crisis, and really, you know, turning the corner on this issue, which is taking, you know, too many lives. And looking forward to hearing from folks today. So thank you.
Well, thank you so much, and thank you to the members taking time out to be here to learn more about what's going on in Indian country with the fentanyl and the crisis that still plagues our people here in the state of California, and then coming together as a body, as a legislature, to hear and come up with solutions of how we could best equip those on the front lines with resources from the state. We're going to now transition into our first panel, and the first panel deals with community impact, friends and family, and it'll be presenters will be tribal chairpersons, students, community, and members. Because of the table setting, I'll call up the first three, and then the next two will come up after that. So first, we have up at the dais, the Viejas Band of Mission Indians Chairperson, John Chrisman, Manzanita Band of Kumeyaay Nation Chairperson, Angela Elliott Santos, and Bear River Band of the Runnerville Rancheria Chairperson, Josefina Frank. And then we'll have Habo Motel of Upper Lake Chairperson Sherry Trippa, and then Morongo Tribal Government Chairman Charles Martin. So Chairperson John Chrisman of the Kumeyaay Indians is one of the nation's most respected leaders in our area in Southern California, seen as leaders in political advocacy of economic sovereignty and in the promotion of tribal government and businesses throughout the nation. Chairman Chrisman is here to talk about the impacts that is plaguing our people. So, Mr. Chairman.
Thank you. So, in my 4 years now as chairman, I have 16 years total in tribal leadership. I have seen the eyes of the people under the influence of this new fentanyl that's just come to plague us. We have taken steps to try to go and actually combat this, grassroots, law enforcement. Nothing has actually worked to this point. I have, in my time now, I'm in my 5th year, we've had 4 deaths, all, if not overdoses, they were suicides under the influence of fentanyl. In one case, I had to tell a mother that her son had passed. He was in the medical examiner's office, and I had to go to her house personally and do that. We have security, we have our fire department all carrying Narcan. When these individuals, some of them have overdosed and some of them have made it, there's been a handful of them, as many as 10, that have taken the Narcan doses. They take as many as 3 or 4 doses of Narcan to bring them around. When you look in the eyes of these people, they come in to see us sometimes under the influence. I had seen the face of this before with the methamphetamine and other drugs. You look in the eyes of these people and it's different. They're requiring more than anything I've ever seen. I cannot get through to them. I try to reason with them. I try to get them. We have a system where we have to basically go and have them volunteer to go into inpatient treatment. They don't do it, or they walk out. And the one individual that passed away on me that I had to tell his mother, he walked out of rehab. And so this is a system that deals with HIPAA and legalities to where they have to volunteer. And so part of the reasons that we don't have any success is because this new sort of chemical takes a hold of them. And when you look in their eyes, they can't, it's like they need a stepping program to get off of this in order to even get through to them at all. We have a county road that goes right through reasoned with them. I've had people come back with guns because they get in their mind that there's some sort of a showdown or something like that. And one individual had to actually be taken and incarcerated for this. He actually had to go do some time because of this, because he had it in his mind that the tribal council and security had some vendetta with him, and he came back with an assault rifle locked and loaded. Luckily, nothing happened. He's still alive, luckily, but these things all under the influence of this fentanyl. And so, reasoning with him, I just talked to him the other day. He's trying to, we basically took his residential rights away because he was a detriment to the community. He's now back incarcerated again. Watched the kid grow up as a little boy, so it's heart-wrenching. The first thing I did for him is I walked him out of the casino because he tried to walk in with a hatchet. I walked him out myself, kept him out of jail. It was very difficult, and when I had to face my general membership because I didn't allow him to go to jail, I told him I saw him as a kid. Well, at this point, he's still seeking help. At this point, he's back incarcerated, but I'm just using a few examples of this. But this is something that, as leaders, we deal with on a daily basis. We have to interface with this facet of our membership, and they have rights too. I do my best to help them. In some cases, I have to bury them. So, without taking too much time, though, I just wanted to at least make my point clear about what this epidemic is for me personally. So,
Thank you, Chairman. And then next, we're going to go to the Manzanita Band of Kumeyaay Nation Chairperson, Angela Elliott Santos. The Manzanita Band is located in San Diego County and belongs to the Kumeyaay Nation. Also, Chairwoman Elliott Santos is currently a delegate of the Southern Indian Health Council. Chair.
Thank you so much for putting this together and for inviting us to be here. My words come from experiencing the painful reality of fentanyl and its horrific impacts on our community. Manzanita is a very small tribe of 155 people. Since July of 2021, we have had 3 accidental deaths from fentanyl. Those 3 people who are no longer here with us were all close family to me. My 2 nephews and my first cousin, who I call my sister in our way, were people that I loved. The impacts of them leaving us early are felt every single day. The guilt of not being able to help them haunts my thoughts every day and tears at my heart. My people have proven their resilience just by being here today. Unfortunately, the baggage of intergenerational traumas, along with stigmas attached to seeking help for mental health and substance use disorder, have brought us to a place where unnecessary deaths happen far too often. These deaths are like pouring salt into an already gaping wound. I asked my niece, Raylene Elliott, to help me speak about her brother, Devin Alto. The next words that I'm going to read come from a young woman in our community who is a cultural leader herself, and she speaks about the impacts to her children and her nieces and her nephews. Our people are resilient. We are to this day stereotyped and plagued with diseases like diabetes and cirrhosis, but I feel like this is new. This is killing people faster than most drugs and diseases. 1 in 4 people have a chance of overdosing, and in our small community, that one person is likely to be a friend or a relative. In this case, it was our brother. Devin was a very respectful person. He was the kind of man who would give up his seat for an elder and offer to help anyone who asked or seemed to need it. He was friendly and could make everyone laugh. He was a good uncle, and the kids would jump and play on him. He was a good dad. His daughters loved him so much, and his son, who was 7 days old when he passed, was naturally comfortable with his dad already. I fondly remember him singing to his newborn son, and it was like a lullaby. He was so proud of our culture. He was very well known, and everyone knew he was a great singer. He was not perfect. He had his vices. Unfortunately, one of them was fentanyl. He passed on July 16th, 2021. I don't really know how to put my pain into words. It hurts physically and comes in waves. Sometimes the waves are small, and others, they are the kind that rise up from the ocean and destroy the shorelines. I think a big part of the hurt is because this time I had to see our younger generation of kids deal with death. Audrey and Darren will literally break down and cry because they missed their Uncle Devo. When he passed was the first time I have ever seen my nephew Gio not only cry, but he was wailing in the corner as his mom tried to comfort him. My 5-year-old will talk about her uncle, then always follow with, but he passed away. Adelina is 8 years old and scared to die. She's scared I'm going to die. I think she's afraid to get close to people because she's scared they're gonna die. The only people she knows who passed were drug-induced, and they died sooner than they should have. I'm watching these kids go through trauma far younger than myself. Our people have adapted and survived through so much, but this scares me more than anything I've encountered because it doesn't really give us a chance. Fentanyl is so powerful and so potent. The amount it takes to overdose is compared to a few grains of salt. My brother didn't have a chance. He had plans to meet me later that evening to sing at a wake. The day he passed, hours before he passed, we were talking about his love for the culture, that he wanted to teach all his nephews to sing and teach all the kids to play our hand game, peon. I honestly feel like he was ready to start teaching. He had the passion to keep our traditions alive. He had a way with the kids. They all looked up to him and had respect for him. He would have been a great teacher. Right now, I don't know who will be the next teacher here at Manzanita. I know someone will rise up and lead the way, but I will always have to wonder how great he could have been. He left 2 daughters and a son who looked just like him. I read somewhere that the opposite of addiction is connection. For our people, that connection comes from our culture. I believe our culture is prevention and always reminds us we have a place in our community. His place was going to be a lead singer, a teacher, and in a way, a healer who could offer that connection to the new generations. I see, as a leader within my county, many things happening that are steps in the right direction. Mental health crisis teams and many other resources that are out of reach to my people. We are too far away, and there are too few of us to worry about. Not to mention that our people need to have our culture as the foundation in these programs. Tribes need funding, regular, recurring funding for each and every tribe. Not funding we have to compete for. That sends a message that all are not important, only some. Funding we can count on to end the cycles that have plagued us since we were stripped of our way of life. In these days of so much talk of equity and making up for the past, our tribes are still in the same position that they've been in for decades, nowhere close to having the resources to truly help our people. I heard today talk of collaboration, and I want to say that would be great. We do have clinics. We do hand out Narcan. We are trying to help, but where Manzanita is, we have 1 deputy most of the time for many square miles. That there's just 1. If you call and it's in the night, no one comes for 2 or 3 hours. There are no PERT teams. There are no mental health crisis teams. But maybe through collaboration in those rural areas, we could serve not only our people, but the other people who are also suffering in that area. We're 10 miles from the border out there. There's a lot of trafficking of all different kinds of things. So I heard collaboration, and that makes my heart feel like there's hope. I want to leave you today with a poem my niece Raylene wrote for her brother, for her brother's funeral. I'll try to get through it without the tears. A brother gone too soon. No gatherings, peon games, or powwow will ever be the same if you're not out there dancing and there's no announcing your name. We were not a perfect family, but our love is very strong. We always had each other's back. We always sang along. Our family feels incomplete again, a brother gone too soon. We will always think of you when we sing beneath the moon. Please give us strength to sing you home. Help us through the day. I believe we'll meet again in the Milky Way. Thank you.
Thank you for that testimony of what truly is happening on the front lines and the call for collaboration within tribal communities that are in rural areas, that as we talk about safety and resources for all in the state of California, that we remember many Indian reservations, Indian communities are in rural areas that take so long to get resources to. So thank you for that, and to your family, my condolences.
Thank you.
Next, we're going to have from Hubble Motel, Pomo of Upper Lake, Chairperson Sherry Trippa. Chairwoman Trippa has served on her council since 2004 and has served on the California Indian Legal Services Board of Directors. Chair.
Thank you. And my condolences as well.
Thank you.
Thank you for holding this this hearing today. I think it's a very important topic that's having obviously real impacts in our communities. My tribe is located in Lake County. It's about 2 hours, a little over 2 hours away from here. Extremely isolated, surrounded by mountains, beautiful area, but it's also the poorest county in California. Our tribe, unfortunately, like many tribes, had a pretty horrific history. We went through termination in the 50s, had to sue for to overturn that. So we're very young in our government. We had to go back through a secretarial election process in 2004, and we were landless as a result of termination. So it has taken us some time to get to a place of stability, and gaming wasn't that answer for us. So revenues, resources are very, very limited. Due to the county's lack of resources, there is a lack of law enforcement, there are a lack of resources in the way of treatment, and it is similar to the chairwoman's story. It is very difficult to get emergency response in a timely fashion. So I just have a few comments to say. Lake County, where many of our tribal members are, roughly 40% of our tribe reside there. As I mentioned, it's the poorest county. The nearest city is 2 hours away. Unfortunately, the opioid crisis is rampant in Lake County and the surrounding area, affecting both tribal and non-tribal populations. Due to the remote nature of our community, lack of resources, and limited staffing, access to things like treatment centers, addiction services, and transitional housing are very limited to those who need it. May I have a tissue, please? Thank you. Additionally, law enforcement and emergency response departments in the area are limited in both resources and staffing, which often leads to delayed responses and, unfortunately, overdoses that are not saved in the time. In speaking with substance abuse disorder counselor with the Lake County Tribal Health Consortium, it is clear that the lack of education, treatment facilities, and general understanding of the effects of historical trauma on Native Americans are some of the major contributors to the fentanyl crisis in our community. Other issues, like I mentioned, lack of education. Many times patients believe they're using other substances such as marijuana and are unaware that some of those substances have been laced with fentanyl. Other issues, lack of prevention programs and harm reduction access in the community. There's a lack of detox treatment facilities in the area, specifically Native American treatment facilities. Currently, the closest addiction center to us are in Santa Rosa and Mendocino County, both an hour and a half away, and they have limited beds. So by the time you literally get someone to want to go, you have to wait weeks to get in. We have seen more success with our Indigenous patients when there is an incorporation of their culture into the treatment programs. The direct quote, this is a direct quote from our Lake County Tribal Health Consortium counselor. We also need to provide education for helping professionals on stigma and the effect of historical trauma on Native Americans in order to combat opioid use in our communities. Many providers, not just in the county, do not understand the impact of stigmatizing language and cultural incompetency on tribal members not wanting to ask for help with their substance use, misuse, and abuse. This leads to increased depression, anxiety, guilt, and shame, which all fuel substance abuse behaviors, as well as suicide, incarceration, justice involvement, domestic violence, teen pregnancy, and death if substance abuse goes untreated. Our total population in Lake County is just under 69,000. The Lake County Sheriff's Office, they're saying the fentanyl epidemic in Lake County is killing people in our community at an alarming rate. In the past couple of years, there's been 60 opioid-related deaths. The general controlled substance-related deaths per city are even higher, totaling 192 just in the last couple of years. In 2022, the Lake County Sheriff's Office seized over 4.5 pounds of fentanyl. And as you've heard, how impactful just a little bit of it is very alarming. Our North Shore Fire Protection District, according to data sent by them to the fire chief beginning in 2020 through today, Narcan has been administered at least 110 times in the Lake County area. What are we doing? With limited resources, we are in the process of opening our transitional housing facility for tribal members and non-tribal community members. The facility is geared towards women with children with a history of drug abuse, domestic violence, homelessness, and family trauma. As we have found that this is where the need in our tribal community is. The facility is set to open in the next few months, and we currently have 7 women and 10 children who are seeking treatment in our facility. Thank you to the proceeds of the gaming tribes to the benefit of limited gaming tribes. That grant enabled us to start this facility. We are also developing a Native-based sobriety and mental health program designed to aid in creating a sober living environment with the goal to open a family resource center which provides counseling for women, children, and families. And we will work with patients to seek outpatient treatment when needed. Our goal eventually is to break the cycle of historical trauma within the membership by educating and empowering children at a young age and teaching them to cope in healthy, safe ways. What can you do? Education. In speaking to the local fire chief, sheriff, tribal health representatives, and tribal director of health services, they all stress that education is the number one need in addressing the opioid crisis in our community. Specifically, a funding mechanism for educational and prevention programs for children and adults who have a history of drug abuse in our community and tribe our tribe cannot afford the resources given the severity of the problem. So even one-time grants, although they're great, they won't sustain this crisis because it is going to take wraparound services to help our people. AB 2033 by Assemblymember Waldron, that is a huge start, but unfortunately it's not enough. And as we've all spoken earlier, that it's going to take all of us to fight this epidemic and hopefully save our people. Thank you once again for allowing me to speak today. Appreciate again the committee's efforts in this fight.
Thank you. Thank you so much for that. Next, we'll hear from Bear River Band of Runnerville Rancheria Chairperson Josefina Frank. Chairwoman Frank is in her first term on the council and currently serves as Region 9 representative for the Department of Health and Human Services Tribal Advisory Committee. She has her degree in behavioral and social services and is working on her second in psychology. Please give a seat to the chairwoman.
Good morning. I was sitting in my hotel yesterday and I was telling my husband, I think I'm gonna just impromptu what I'm feeling. And then I changed my mind and I had to write it down so I wouldn't mess it up. When I was initially asked to speak here today, I was beyond excited because for the years that I've been serving on council, my first term, I've been telling council that we need to have a seat at the table. And to finally have this seat at this smaller table is truly a blessing. The moment, though, is bittersweet because although I'm happy that I get to share our story, it comes with sadness because our story consists of our community passing on, our tribal members, elders, children, all losing their lives to the drugs surrounding them. I reside in the heart of our rancheria, and day in and day out, I see the effects of fentanyl amongst our community. It has reached our elders, our young adults, and is slowly making its way down to our young children. Young adults that I have watched grow up and that have played with my children have now become addicted to this drug that is down destroying their lives. I see our elders struggling, seeking a way to cope with the traumas that they have endured, and day by day, little by little, we lose them. We lose their wisdom, we lose our culture, our language, and everything that makes us one with Creator. This is my life as a community member. Where I am at now and the position that I currently hold carries great responsibility and great balance. I took an oath to serve my people, to protect them, and to help them. And sometimes it seems that we forget that, and that positions are placed over people and their lives. And I don't ever want to forget that I fight for my people. I want to ensure that our elders live their best lives and that they know that they are loved and looked up to. I want our young adults to see just how special they are and that they are valued. I want our young children to be able to play outside without having to step over needles or to be fearful of running into someone they don't know or picking up a library book that has a needle in it. Our children should be able to be children. We were never people of substance or the abuse of such, yet here it is, and what are we doing to prevent it so that we can help those who need our help the most? All of us in this room are in a position to make change, to collaborate and combine efforts so we can save who we are meant to be and our generations to come, our next leaders, who I pray will not have to have these same conversations. I understand the hurt and I understand the shame one feels when they are trapped in a vicious cycle, because I too have been there. And for that reason, I will do everything I can to break the cycle of pain and anguish that is leading to addiction within my community. It is my hope today that we can all walk away with new allies in this war and truly come together to aid in the removal of fentanyl from our communities, not just for my tribal community, but for all. If we're not fighting to save lives, then what are we fighting for? One of the biggest barriers that Bear River sees, and we're also rural up north, about 5 hours north from here, is the relationship that we have with our sheriff. As you stated earlier, Assemblyman Ramos, it's not our native people that are producing the drug or bringing the drug in. It's non-natives that are bringing it to our community. But we're punishing our tribal members because those are the only ones we can punish. And by doing that, we do a disservice to ourselves, to our people, to our kids, taking their parents away, kicking their parents off of their land where they were born and raised. That's the only thing we can do. Our police department, we have a lot of concerns with our relationship with the sheriff's department in Humboldt County. And we've been working on that for the last 3 years, trying to build something good, trying to build collaboration. And it's fallen on deaf ears, which is very frustrating because we see the need to be able to work together, and it's not happening when we have a need for assistance to come out to ask or remove non-tribal members that are bringing these drugs into our community. It's gotten to the point where it's just, you deal with it. We'll come out when it's good for us. And that's not good for anyone, because our kids are seeing family members having to leave. And it's not a good feeling to sit on council and the only option you have is to kick one of your tribal members out of their home, because there's no consequences for anyone that's actually bringing the drugs to our community. You know, our kids are fearful to go outside and play because they've came in contact with many things. The drugs, the needles. It's unfortunate that we have to teach them what those things are. It's realistic to do so. But our kids shouldn't have to go outside and come back in and tell us, well, we don't want to play outside because there's needles all over, or there's whippets, or somebody left a bag of drugs, or there's people we don't know in the bus stop that's supposed to be their safe place in the morning when they get picked up to go to school. And we're having to go out of our way, it seems, to cater to those that don't reside on our rancheria and have our kids locked inside the house while we take care of somebody else. And I don't know at what point in time our culture as Indigenous people has come to that. We're losing ourselves every day that this is around us. And when we think about sending people to treatment or sending tribal members to treatment, it does no good if they don't want to go on their own. And it definitely doesn't do any good when we send a tribal member to treatment and the only place that they have to come back to is the same place that was giving them the drugs in the first place. When we're not healing the home while they're at treatment, we're doing nothing. And those are things that I would ask that you take with you to look into, because we need holistic healing for the entire community, not just for one person that's having a problem at that time. And I also want to reiterate that it's important for us as tribal leaders to understand that it is an illness, and not to be so quick to judge someone because we don't understand what they're going through at that time. Thank you.
Thank you. Thank you for that. Very powerful testimony. I mean, healing the home. We could do all these things and talk about volunteer and even start moving in a direction of non-volunteer rehab. But if we're not healing the home, then what are we doing? If we're not healing the home, meaning the tribal governments, right, and safety in those areas, then what are we doing? Thank you for that powerful testimony. Our next speaker is Chairman Charles Martin from the Morongo tribal government, who continues to be an advocate for our people in areas such as ICWA and fentanyl and other areas that plague our people. Chairman?
Thank you, Chairman Ramos. My name is Charles Martin. I am Chairman of the Morongo Band of Mission Indians. I, like you folks, have lost loved ones, a nephew. One of my councilwomen has lost a grandson due to fentanyl. I think what's even more bothersome to me is now you've got a new drug that has made its way on. And it's mixed with the fentanyl, and the Narcan is not bringing folks back. I, like you, have many similar stories. We have had one gentleman been brought back 4 times. 4 times he has been brought back. I think my biggest fear, folks, is that, and I talk to my children, I've got a 15-year-old, a 12-year-old, and a 9-year-old, and my biggest fear is, and I speak to them all the time, please don't do drugs. Please don't do drugs because you may not come back. It only takes one hit. We all know it only takes one hit. But nowadays, it's addiction is there are many forms of addiction. And peer pressure is great. So I know this is a complex problem. Appreciate the discourse that is transpiring here today. I know that just recently I was before the appropriations in DC the other day and did ask for, since they were doing their budgeting process, for more money for Indian health and for policing. So again, this is a complex problem. Again, I'm hoping through discourse that we can come to some solutions so that we can, if not eliminate it, at least ameliorate some of the issues that may help us on this endeavor. I thank you for taking the time to invite the tribal community so that they can give their testimonies, because I believe it's the first step. Again, this is not something that just affects the tribal communities. It's affecting every community, but it's hitting our communities even harder. So thank you for your time.
Thank you, Chairman, and thank you to all the chairpersons for testifying on this important topic that's bringing poison into tribal lands, but yet bringing up the discussion of the mental health component. And the healing of the home is pretty powerful. I'm not sure if Assemblymember Waldron had any questions or comments.
Just that I also want to thank you for coming and testifying. I've been making a list of all the different issues, and as we said, it's a really big bite at the apple that we have here. Mentioning about having young children in the home. Back when I started working on the opioid task force, my son was, I think, 8, and we, as a parent, it is such an overwhelming responsibility because every day they go out into the world. You just have to say, if you have a headache, don't borrow an Advil or Tylenol from anyone. If it's not coming out of a bottle that you bought, it could be laced with anything. They make the pills look like candy. It's this really scary world. The awareness, especially the cultural awareness, the generational traumas, things that we deal with all the time, especially when it comes into the incarceral settings and all of those things that we need to really get to the root causes of stopping putting finally the end to these traumas, so that people can be self-aware and deal with these issues as well. Because, as these drugs are coming in, we almost need to set up a defense to it in some way.
Thank you. Thank you for that. And really, we're talking about, and we talk about historical trauma, but are we doing enough in talking about, in the state legislature, about present trauma impact? And this definitely qualifies as one of those. But yet, as Indian people, we know that trauma continues to move forward, which leads to the mental health component of the healing of people, making a safe environment for our people, and the policing, making sure that public safety, when we talk about public safety in the state of California, that does include tribal communities in the most rural areas. So I want to thank you for taking the time to be here to bring these issues forward. At this time, we're going to transition into our next panel, which will deal with law enforcement overdose response teams. We have Yurok Tribal Court Chief Judge, Judge Abby, Yurok Tribal Police Chief Greg O'Rourke, Del Norte County Sheriff's Office Sheriff Garrett Scott. They make their way up to start. Chief Judge Abby is the first Native American woman to pass the state bar and become a judge in California. She has served as judge at UROC since 2007 and was recognized in the legislature as one of this year's honorees as California Women Making Her Story in the state of California. Judge Abby.
Thank you, sir. Thank you. Thank you for inviting us. And it is a very hard topic, and we've lived a long time being invisible, and we've paid a horrible price for it. And now that price, as we're talking about historical trauma, each of these numbers that you hear, each of those numbers leave survivors and create tomorrow's historical trauma. So this is the gift that keeps on giving back over and over and over. I will leave you with a paper that talks about the numbers that say the leading cause of death for 18-year-olds to 45-year-olds now is this, fentanyl, in the entire country, not just for us. You know, we cannot ignore this, and we need to be in partnerships with our natural partners, and that means law enforcement, it means health services, it means we need mobile clinics in rural areas, we need regional treatment centers, not treatment centers that we have to go hundreds of miles to that may not have room for us. This is not right. This is a state that can do better and needs to do better. It's not fair to say, okay, law enforcement, this, that, whatever. Well, look at how poorly staffed they are numerically. What in the world do you want from them? You know, look at this. I look at my chief and I go, he and I have talked about this a lot. And what were they before? They were our protectors. They would protect us. They would pick up people and take them to treatment if we had some place to take them. We don't. And that's the bottom line. They would do this for us. They would be protectors. That's why many of them went into this profession. You know, all the this, the that, the harm, some people like them, some people don't. I'm telling you, I spent years working with law enforcement, and the majority of those people in uniform got in uniform to help and be of service. And we have not enabled them to do that. He would know who's sick out there. He would know, and he would be gentle with them because he knows all of their relatives and all of their families, and because that's who he is. And again, it's where can we take them? We need these regional treatment centers. We need mobile health clinics. We need to be able to maintain. This is different than what I grew up with. This is not abstinence. Abstinence now will kill you. And you know how I know that? Because more than 50 years ago, my mother got addicted to opioids, and they cold turkeyed her, and then we buried her. And she was invisible then, and she's still invisible except to me. And there's a lot of those out there. And we need to look at that, and we need to address that. Because it's getting bigger and bigger. And it's a monster, and it's coming for everybody at this point. But it's a monster we can win against if we unite and not just say, well, this tribe or that tribe. No, it's by region. It's our neighbors. I'm not going to walk past somebody who's not Yurok, who's dying in the street. I wasn't raised to it, and I won't do it. You know, and we need to do better. And we need to look at these things from a regional, territorial area and solve them from that area and make that available to people. We have done tons of Narcan training. We'll continue to do it. As a court, we do that because I think it's our responsibility. We'll do what we can, but we need help, and we need help for the region. You know, I don't want it just for us. You know, and like the chairperson said of Bear River, we need to do this, and we need to do this together. And it's not just about us. It's about rural areas. You can't keep not addressing these issues. You can't expect us to keep burying people like this. We don't have the capacity for it. We're just human beings, and we can't do this. Thank you.
Thank you, Judge Abbey, for bringing those comments forward. Certainly, we need to look at the regional approach, which differs in other parts of the state of California, but allowing law enforcement to be able to do their job is another topic that we've been tackling. Certainly, you know, the complexities of Public Law 280, greater than I know with your capacity. But we know that somehow we have to start the discussion around those areas to ensure that public safety is something that can be awarded also within Indian country, and looking to our counterparts to bridge together and work together in collaboration process to make sure that safety for all is there. And you bring up another area as far as Indian people feeling invisible and having to fend to these crises that come our way. And in this case, today we're talking about this poison, fentanyl. But for years, because of the historic and present day ongoing trauma, Indian people still feel invisible to all these different issues that are plaguing here in the state of California. We've talked on bills and different committees on the impact of fentanyl, but yet we're here on a separate hearing to bring to the attention of legislators the impact that it's having on Native American communities. You talked about crisis stabilization units and mobile units that have been approved for parts of the state of California, but are we doing enough for our tribal communities and making sure that those stabilization units and mobile stabilization units are afforded to our tribal communities who are in some of the most rural areas in the state of California? So I want to thank you for that, and would love to follow up on any further ideas that you might have to be able to bridge that together, bring the resources to Indian country. And thank you. And I just want to say thank you for your service to the Indian people here in the state of California and to the whole state of California as a Native American judge and the first Native American woman to have that position. Thank you so much for that. Next, we'll hear from the Yurok Tribal Police Chief, Greg O'Rourke. Chief O'Rourke has a career in law enforcement spanning 23 years, and of those years, 10 have been with the Tribal Police of Northern California. Chief?
Greg O'Rourke. Good morning, my name is Greg O'Rourke, and as you said, 23 years in law enforcement, and during that time, I have responded to overdose calls 3-4 days later because the people in the room were too afraid to call law enforcement or call 911. I've responded to overdose calls that were fresh and work like hell doing CPR to try to save that person's life while we're waiting for the paramedics to arrive with Narcan to be able to administer it. I've gone to families and had to tell parents that their child was dead because of an overdose. And the reason why I bring this up is because I am ashamed to admit that even throughout that time and seeing the impacts of fentanyl and opioid use within my career, I still had that stigma attached to it of, well, they shouldn't have started using. And it wasn't until my sister died of an overdose when that shift of perspective became very personal and very relevant. And the reason why I bring that up is so that way my words have professional and personal relevance here for this. When I'm listening and sitting and listening to our tribal leaders speak, I hear an overlying theme of an invisible voice of the intergenerational and historic trauma. And what that tells me is up and down the state of California, there are these themes that are present. Now, from a law enforcement perspective, when I came into this profession, it was 8 years after Rodney King, a very transformative event that changed law enforcement. By the time I got into the job, policies and procedures were in place. Well, post George Floyd we're right now in the midst of the transformation, and we don't know where it lies. What I would like to be able to put for consumption to our state legislature is to look at the first people and what we have to offer. Restorative justice, a few years ago, was a big buzzword up and down the courts. Well, that's a model that we as Native people have had, and we used as form of conflict resolution for generations. When I was going to the academy, we talked about the warrior mindset. Well, now, post-George Floyd, we talk about the guardian mindset, and that's what's being taught in the academies. We were not a warrior people, but we did have the village protector. As the judge so eloquently put, that protector made sure everybody in the village was taken care of. These protectors ate last. These protectors made sure everyone had a safe place to sleep. And that's the archetype that, as chief of tribal police, I can implement within my department. And now I would like to be able to put forward another idea of actually adopting a trauma-informed policing approach to our communities to be able to actually deal with trauma. Law enforcement, we are really looking at the impacts of trauma and how it affects cops. Well, trauma is trauma, and those manifestations and the symptoms of trauma is what we're seeing up and down the entire state. Every single community that's come up here and testified has made reference to trauma, and we, as tribal police, adopt a trauma-informed approach because we really are the paragon of community policing. I understand that reform is a big word and right now on the Hill, and I'm not opposed to that. I know that cops need more training, and I know that de-escalation is a big issue, but what's lacking is focus and how we can focus that training and that de-escalation. And I sincerely believe that a trauma-informed approach is that focus that we, as tribal police, can be able to bring forward to the state, because Native communities aren't the only ones that suffer from trauma. So every community of color up and down the state, across the country, suffers from trauma and those impacts of trauma. And everywhere up and down the state and across the country, we're hearing cries for police reform. And so when the question gets posed, what can my legislators do? Don't ignore your first people. We have something to contribute, and we want to. We want to be here. We want to be able to lend our voices to this. We want to be able to take an active role in how we can overcome this obstacle within our community. I'm not opposed to the oversight, and I'm not opposed to legislation. We just want to be a part of it. And, I must say, as tribal police, the biggest oversight that I ever had to deal with was my grandma or my aunt or my mom calling me afterwards and saying, "Why did you do this, son? Why did you do this?" Because we're held accountable to our community. And that's ultimately what law enforcement is supposed to do. Our job, when it comes down to the very basic Pelian principles of law enforcement, is to protect the vulnerable. And law enforcement is asked to protect a vulnerable community, but yet you've heard testimony from chairs that law enforcement is not able to facilitate a timely response, and that's for a different myriad of reasons. And please, I'm not casting aspersion on allied agencies. I'm sitting next to the sheriff of Del Norte County, who I consider my friend, and we're here together. So again, it's partnership, and then that's what we can offer. So thank you.
Thank you for that and the partnership and bringing up that as we start to look at different police in the state of California, don't overlook the words or the impact that California's first people could add to the discussion. Thank you so much for that. Our next speaker is the Sheriff of Del Norte County, Sheriff Garrett Scott. Just started his new term as sheriff on January 3rd of this year. And he was first appointed in 2022 and then ran unopposed and is very engaged in the topics throughout the state of California and here engaged in this topic. Sheriff?
Well, thank you. I appreciate that. It's a pleasure to be here. It's a pleasure to try to build partnerships and do what we can to work together, and that's something that I credit working with Chief O'Rourke. I mean, it's been phenomenal trying to make things happen and getting things rolling to help him out too. And so, but across the board, what I wanted to talk about was specifically for Del Norte County. You know, we're a population of 28,000 people, and so I wanted to talk about the fentanyl overdose deaths real quick, and then move on. But the important part was from January 2022 to December 31st, 2022, we had 33 total drug-related deaths, and 19 of them were fentanyl overdoses. That's deaths. So as the sheriff coroner, I have that information. But for a population of 28,000, that's pretty sickening. So I also wanted to put out there that I had 2 different law enforcement officers that were exposed to fentanyl out in the field. One was actually one of Chief O'Rourke's officers, and then one of my deputies later in the year. So we've had 2 different exposures that were very serious. Narcan was deployed and so forth. So, you know, that's also something that really concerns me. When you have to train your drug dogs when they detect fentanyl to back off and sit down, it's that dangerous. So it's the old days of doing searches with canines has even changed because the danger of fentanyl. So, you know, those are great. I don't have any stats for how much Narcan we've deployed and how many saves we've had. I'd like to come up with that for you guys in the future so that we could kind of see how effective we're being in the field as far as how many lives we're saving. But I can tell you it's nearly daily. And watching the folks go through it it's terrible. But to have the Narcan out there and have the field personnel trained to use it's phenomenal, the job that they're doing without any more resources than Narcan, and that's it. We're also seeing fentanyl smuggled into the jail, and we're having to use drug dogs in our jails and searches there as well. In the last 6 months, I've had to deploy at least 6 doses of Narcan to different people within the jail, and it's a constant issue. Luckily, Pelican Bay State Prison is within my county, and they come in and help search and have a vast amount of experience in searches. So they've been real helpful, coming about every other month to do searches on top of what my corrections department's doing. So really, you know, the partnerships are important. The legislative movements that y'all are taking is phenomenal. I know Sheriff Hansel's not here today; his family is sick. But the California State Sheriff's Association did support a number of bills and is very active. But the one that we wanted to really push was AB 462, and that's the overdose response teams, the funding for that task force. I applaud you for bringing forward all these different bills and pushing so hard to get some funding directed towards fentanyl. And I think that the overdose response teams is key. It's a brilliant idea. It's going to be effective. I'm also supportive of our mental health mobile crisis units. Those are also going to be extremely effective. And getting the partnerships from law enforcement, healthcare professionals, mental health professionals, that's what we've got to do to make this all work out and network together. And so I applaud you guys for what you're doing. It's not an easy task, and we've got a long road ahead of us, but thank you all, and it's a pleasure to be here.
Well, thank you so much for those comments. And AB 462 deals with response teams and is working with counties, predominantly with Riverside, Orange, and San Bernardino County now, that could then become a statewide policy gathered with data and input. We also know that the Sheriff's Association, we've presented in front of them a couple of times on their agenda, and we'll continue to work with the Sheriff's Association on these topics. And policing within tribal communities still is something that still plagues our people, even from the 60s and 70s. All those issues still haven't risen to an area of where we're hearing dialogue from both sides at an equal voice. And so we have to be able to move forward within that discussion. And Judge Abbey, I can't say enough for what you've done for our people and the state of California as a whole, and in bringing up these issues. When someone feels invisible and they go through some of these mental health challenges, who do they reach out to? They feel that because of the history and what's still going on, that no one's listening. But by being able to be in the state legislature, where representation truly does matter, we have to start to make sure that people don't feel that. And that's breaking down the stigma of someone reaching out for mental health resources. We have to destigmatize that so that then when people do reach out, that they're comfortable reaching out. And we know that a lot of times destigmatizing and using those terms could be carried out and interpreted different outside of Indian country. Because we know within the tribal communities, we have Indian Health Services, we have the different services that are out there. And everybody knows who's going in to get what services they're getting. So we have to do a better job in making sure that those resources are available. So we'll continue to work on those issues, but I want to thank you for all that you've done and for being on this panel. Any comments or questions?
Go ahead. Thank you so much for your testimony and your leadership. I also wanted to apologize. I had to step out to present on a few bills, including on a bill that relates to access to treatment for opioid addiction. I did want to follow up on a couple things that were said. You know, one is just to highlight how important the point, and I'm sure others made this point as well, about the role that trauma plays in addiction, and how when we respond or intervene in someone who is experiencing addiction, that we have to treat them as a whole person. There's not a single pill that you can give somebody. You have to acknowledge all of the different things that a person is going through, and they have to be embraced and treated by an entire community. And that's one of the things that, for me, as we look at what is happening on tribal land and how we can support those efforts, that is such a critical part of it. How do we make sure that people are included and not pushed away? And often when people are addicted, they feel that they can't talk to anyone about it because of this stigma that the chair spoke of, and they get pushed further and further away. And that is particularly when you're talking about drugs like fentanyl, is when the extreme danger comes to people, when they're doing this in such darkness, is when the greatest risks come about. And so we want to bring people back in and make sure our systems are able to do that. Two things that I wanted to ask of the sheriff and chief as well. One is, we've been talking a lot about access to naloxone and Narcan, and particularly for the tragedies of the people whose lives were lost. If there is anything that you're seeing in terms of where those overdoses happened, or where we could have, particularly in your role as the coroner as well, could have had interventions available to have those folks be able to still be with us. And then also, if there's anything you're seeing in terms of where the drugs are coming from, or if they're being mixed with certain things, or sort of any patterns that you're seeing on the fentanyl itself, and any sort of things that you think we could do on the law enforcement side to try to address the flow of those drugs in such a dangerous way into our communities.
That's a complex question, because fentanyl is affecting so many different people. There's so many different groups and it's hard to pinpoint where things are happening the most. It's easy for me to turn towards maybe we have more activity in our homeless camps, and we're using Narcan more there. But realistically, seeing, maybe statistically that is, but seeing where the overdoses are happening throughout our community, it's not necessarily the case. It's across the board from schools, high schools, all the way up to our rural areas and our nicer neighborhoods, so to speak, too. So I think it's important that we continue to get that Narcan out and get the education out. The last couple of interesting Narcan deployments that we've had, we've gotten 911 calls from folks, and by the time we've gotten on scene, the person's already been given Narcan by one of the other users that's there that knew what to look out for. And I've had conversations with a lot of groups about education and fentanyl, and we need to let people know how dangerous it is. But when you're out on the streets and you're working narcotics undercover or any of that, they know how dangerous it is. That's already there. So giving them that Narcan is helping them out. And I think the education needs to happen more so with our kids, with the candy and all that stuff. That's what really concerns me the most is our schools. And having been a school resource officer quite a few years ago for a number of years, schools should definitely be one of our big priorities for education.
One of the trends that we've been seeing in law enforcement is cutting agents with fentanyl, xylazine, and other types of tranquilizers that have been proven to be non-effective when naloxone or Narcan has been deployed out in the field. And so we're seeing those tools that were given to the community be non-effective. And in regards to routes and running that we see, one of the things that tribes have been able to do within the state to express sovereignty and gain some flexibility financials with casinos, and with a lack of law enforcement presence on reservations, reservations are a place where it gets funneled to. And so that trend is there, and it's been simple. We saw that with trafficking, and we're seeing that with fentanyl, that reservations are just targeted areas because of the symptoms of trauma that reservations have to deal with, and with a very distinct lack of law enforcement presence.
Thank you. Any other questions? I want to welcome Assemblymember Aguirre Curry. Go ahead, Assemblymember Walden.
Just really quickly, speaking of the tribal government specifically, when you come upon a person who is in the overdose and you're administering Narcan and, they revive, what happens to them then as a member of a tribal government? Are you seeing them getting into treatment? Is there, the options aren't really there. Like, what happens to that person? What's the trend that you're seeing when you...
So, for me, from what we've seen, is because funding is difficult, when someone's in crisis, it's usually not during 8 to 5 on Monday through Friday. They go into crisis at 2 o'clock in the morning on a Saturday, and that's when we need to be able to have a place or response to respond to somebody when they're in crisis. I've had times when I've had people at that low moment of clarity when they hit their rock bottom and sitting next to them on the side of the road at night, begging somebody to be able to help, but there's no one to help. And then when Monday comes, they've passed that and they're back into their trend of using. So when someone has been, an overdose, or when someone has been able to come back from one, we make sure that they have follow-up, but that follow-up needs to be immediate. And we just don't have the infrastructure in place to provide an immediate follow-up, some place where they can safely detox and then start their therapy, their counseling sessions, to address the trauma and addiction. They don't need jail, and they certainly don't need to be put in the hospital, but they need a safe place to detox. And we just don't have those in Indian country.
We really don't have them in rural areas, and that's the big thing, you know. We're more than willing to share, and we need to share, because you don't want this happening to your neighbors. But that's the point. When he's sitting by the side of the road with that person, he's got to have some place. He's got to have a mobile unit come out and take them back for help. And when that time passes, it's passed.
Thank you so much for that. Any further comments? Well, thank you for this panel and enlightening the legislature on this topics and how it's affecting Indian communities with policing and the lack of resources that are there. Thank you so much.
Thank you.
Oh, yeah. Thank you. Thank you. We're now going to move into our final panel dealing with healthcare providers, medical centers, and perspectives. We have Oxwin Homquan, Director Amy Admer, California Consortium of Urban Indian Health, Executive Director Virginia Hedrick, from the Friendship House, Supervising Clinician Nelson Jim, and Sacramento Native American Health Center, Chief Traditional Health Officer Nathan Blacksmith, and Kimyai Medical Center, Hoopa, Behavioral Health Director Boyd Ferris. Got them all. Is everybody up? Yeah? All right. Let's thank you for being here and providing this much needed discussion. We've heard from tribal leaders. We heard from the law enforcement, from the courts to tribal police to the local sheriff in the area. But now, hearing from the front lines, those that are there with the intake and the different things that maybe we could enlighten the legislature on the needs and the resources that also need to translate into our area. So with that, we're going to start with Director Amy Admire. Admire is from the Rincon Indian Reservation. She has advocated for her community for over 20 years, working towards the reduction of the impact of trauma against Native peoples.
Miwam, thank you for having me today. Really appreciate being here with this esteemed panel. Notung Amy America no Washnai no Pamkowish. I'm Pamkowichon from the Rincon Indian Reservation. I have been teaching culture and language to our young people throughout San Diego County's reservation system for over 25 years. So again, thanks for having me. I want to take this time to introduce you to my son Nokamai. When my beautiful son is well, he enjoys producing music, being helpful to family, looking sharp, and keeps a cleaner room than I do. My son was raised a traditional storyteller. At a young age, my son encountered a series of traumas that left him susceptible to the allure of feeling no pain. My child is now sick with addiction and is being robbed of the life Creator means for him to have. And I am being robbed of my son. I ask you today to help us reduce harms against our children that make them susceptible to substance use in the first place. I have asked young people why they continue to use knowing they might die. I've been told because no one cares about us. In order to understand why young people are subjecting themselves to illicit drugs that may kill them, it's important to address the social structures that contribute to their feeling of being uncared for. One of those causes of harm is the under and miseducation of our students, paired with consistent racism and well-documented stereotyping of our Native children within the public school system. We have heard the term school to prison pipeline, And while the practices of incarceration are a problem, some of us who work in education have observed a more emergent trend, which, for a lack of a better term, could be described as a school to addiction pipeline. Micro assaults against and racially motivated low educational expectations of our Native youth cut away at their self-worth. They do not see themselves as the sacred beings they are of the ancestors who survived so that they could be here. Our young people report that they are disproportionately targeted by searches, suspensions, discrimination, and are being pushed out of school. And not only do they report that to us, but the data shows it. In the last year, our students have been called featherheads. We're told they deserve to be raped and that they should have died when the pilgrims came while they're at school. They tell us the schools sweep reports of such abuse under the rug, and our children are heartbroken at being treated this way on their own lands. This type of hateful violence would leave any child feeling uncared for. The 1969 Kennedy Report on Indian Education identified historical racism in education that has yet to be resolved. Of the many asks and needs, we present 4 critical changes to stop the school to addiction pipeline. First, we ask that the state create a department within each county office of education to oversee accountability for ensuring the government's trust responsibility to provide equitable education to Native American students. San Diego County is home to one of the largest Native American student populations in the state. Yet of the 10 departments housed within the SDCOE, not one of them is dedicated to serving their unique and specific needs. Second, we ask that the state establish a process to discontinue the dehumanizing term special projects when referring to Native students and migrant students and our students in general, and instead create departments within schools with large numbers of Native Americans dedicated to their education and protection. Further, we ask that their mentors, the people who look like them and have their same lived experiences, stop being called guests on school campuses and seen for who they are, essential and a lifeline to resources. Third, we ask that the state actively enforce existing laws. There's already laws meant to protect our children regarding tribal education and require school and county boards to educate trustees to tribal education needs and legal protections so our children can no longer be ignored. Fourth, we ask that Native American students in heavily populated areas be added as a 4th subgroup within the LCAP to ensure that adequate resources are directed towards them. Without us being identified, the schools don't have to direct money towards services. 50 years has been too long to wait for these basic changes. Opiates, such as fentanyl, saturate our communities. Our children tell us they are everywhere. And we have 8th graders with opioid problems, exacerbated by the pandemic. We know they're not returning to school. And because school is not a safe place for some of our young people, they don't want to return there. And school should be a place where our children feel safe, where, as I heard before, a lot of education should be happening for our young people in those spaces. The time to implement structural changes is now. We don't have time for incremental changes any longer. Help us end the school to addiction pipeline and systemic harm against our students. Please show them that we care for them. Stop the practice of neglect that leaves them susceptible to self-harm. Wow, thank you.
Thank you. Thank you for that powerful testimony. And bringing attention to much needed areas that, as a state, we need to continue to look at. Next, we'll have the California Consortium for Urban Indian Health Executive Director, Virginia Hedrick, is an enrolled member of the Yurok tribe and is of Karuk descent. She has more than 13 years of public health experience and has her MA in public health. Virginia.
Aikui Nakna, Virginia Hedrick, Shregon Mewamechuk, Nekpulakla. Thank you for having me and thank you for being here. I'm a member of the Yurok tribe and was born and raised on one of the most remote areas of our reservation without electricity, phones, or internet. What's really funny about that now is I've spent my entire adult life as a sidewalk Indian living in an urban environment. I live and work here in Nisenan territory where I'm raising 5 children in the capital city. I'm the executive director of the California Consortium for Urban Indian Health. We're made up of 10 IHS contracted urban Indian organizations, which include the Friendship House in San Francisco and a program in Manteca. In 2017, Sakui launched a medication assistant education program. It was the first of its kind in California and continues to be among the most widely circulated opioid education materials in California and distributed nationally as well. In 2022, we launched the California American Indian Harm Reduction Work Group, which is a sister program to the California Indian Opioid Safety Coalition. Just 2 weeks ago, one of my childhood friends overdosed while smoking fentanyl in her car overlooking the Pacific Ocean. She wasn't trying to die. She was just trying to escape, if only for a short time. Fortunately for her, her brother was with her and was able to get her access to care within 10 minutes. She's been fighting for her life every day since then. She's just a few blocks from here. Because she was life-flighted over 300 miles from her home to the closest place of care. She was lucky. In the days following her overdose, I know 3 people under the age of 50 who have died. No car accident mentioned, no long-term illness, just social media feeds full of love, prayers, and condolences. As a community, we're left to fill the gaps. And we know our people are struggling. We don't always know if they're, quote, clean or back on the wagon. But what we do know is the holes they leave behind. As a public health professional, I've been involved in a number of emergency public health campaigns, including H1N1 and the most recent COVID-19. I'll use COVID-19 as an example for a public health campaign. We saw an entire world shut down because we were afraid to die of an infectious disease. Everyone was afraid. We saw entire departments, divisions, and teams be built in matters of days. We saw historic funding to Indian country in an effort to prevent the spread of an infectious disease. Yet we have been living through an infectious disease of opioid for decades, and we struggle to fund harm reduction programs. We still whisper about overdoses, and while nearly every Indian person knows someone who's struggling with an opioid addiction, the stigma is thick. We want to talk about fentanyl like it's accidentally confused with candy, which does happen, but we can't not talk about our relatives who are deeply impacted by historical trauma. The most recent opioid California data dashboard shows Indian people are overdosing at higher rates, yet we're among the lowest in ER and hospital admissions. We just die, and no one seems to care. I refuse to accept this as our norm and offer a few solutions. Traditional healing support services has to start with funding, and not only funding, but seats at the table, and traditional healing departments staffed by our own people. Harm reduction models created from an indigenous lens and used within our communities throughout the state by our people to teach our people about harm reduction in a way that resonates with them, reducing stigma around harm reduction. I told you about my friend who's still alive because she was smoking with her brother. I didn't tell you about my uncle who died alone in a hotel in December with a fentanyl overdose. I can't help but think if he had just had someone there, even just using with him, he might be alive. Funding to our tribal and urban community where the work is being done in a culturally responsive manner so we can increase our capacity to do the work. Intentional engagement and consulting with our communities. More funding to culturally responsive treatment centers, second stage housing programs, employment programs, education programs, and give our people opportunities to work and give back to the community. Purpose, an opportunity to feel a sense of belonging to our culture and feeling welcomed by our community is prevention. Flexible funding and evaluation for programs like Sequoia's who are able to develop projects that work best for our own communities. Compensation for community consultants and advocates who provide feedback on incorporating cultural-based harm reduction. Community program for youth, parents, and elders that gives them a safe space and a place where they can learn about harm reduction and all prevention through a cultural lens. Indigenous wraparound models that support families in the home and in the community. As Indian people, we have been in a constant state of grieving since time of contact, and the fentanyl crisis is ravaging our communities. We continue to look to state government for support. Wakla.
Thank you. Thank you for that powerful testimony, but also for putting out their ideas of solutions that would impact our people. And our prayers go out to your friend, family, as they continue to deal with these issues. Thank you. Our next speaker from the Friendship House is Supervising Clinician Nelson Jim. Mr. Jim is a citizen of the Navajo Nation and is a licensed marriage and family therapist. He was instrumental in developing and implementing and enhancing the medication-assisted treatment for Native Americans with opioid disorder. Mr. Jim.
Thank you. Yat Bena, good morning, all my relations. First want to say thank you for inviting and bringing us to this table. My name is Nelson Jim. I've been with Friendship House for the last 5-6 years. I've been working in San Francisco with the Native American Health Center and also the community for the last 30 years. So a lot of my work for the last 20 years has really been in the field of mental health and also public health. And more recently, in the last 10 years, working with a substance abuse component. So for Friendship House, we were established in 1963, so this year has been 60 years providing substance abuse services for American and Alaska Native. I have to acknowledge our founder and also our late CEO, Helen Devar-Wakazu. Helen and 3 other Native women actually came together, just as we are today, and said, we got to do something. Our Indian people were being displaced, have been displaced and sent to, rural, actually urban setting like San Francisco. A lot of them had succumbed to substance abuse. Back then, it was mainly alcohol. So that's where we come from today. And her vision and their vision was basically to bring our families back together. Because what happened subsequent to that, when we were separated from our families, a lot of our Native families, a lot of, that are now in that generation, have been put in boarding schools, oftentimes in many places. For Helen, she was in Intermountain, and she comes from, in New Mexico. So a lot of displacement was really about, separating our community and separating our families. So initial to basically her basic, drive was to bring our families back together. And today, as we're sitting here, we want to bring our families back together. We also want to save our people. They are dying, and a lot of the work that we do is really about saving our people. So Friendship House is basically accredited by CARF and also licensed by California Department of Healthcare Services at the 3.1 level of care designation, which basically means that, by the time they get to our facility to be approved for treatment, they have to have a disorder that have impacted their health overall and whole person to the point where they need treatment. So for our facility, we have an 80-bed facility in San Francisco, both men and women. We also have a 9-bed facility for women with children in Oakland. A lot of our clients come from all over the country. Majority of our clients do come from California tribe and communities. For the most part, I think that most of the referrals that we get are either from Indian Health Services, detox, and also from jails, county jails. So that's where a lot of our people come from. For the fentanyl specific, most of them come from either detox, hospitals, or jail. That's kind of where our demographic is. So for our, what I want to present is basically just sort of a profile of our, from our data on our clientele that is very specific to opioid disorder, but more specifically to fentanyl. So from our 2018-2022 4-year span, we had over about 1,200 intakes, meaning that they've done the screening, they've done the intake, and then they were actually admitted. Out of that population, about 65% of the had general opioid use, and sometime in their substance use, but not their main drug. Clients with opioid use disorders preferred fentanyl for 48% of our clients. So a lot of folks that are coming in, 48% of them use fentanyl as their preferred or primary drug. Fentanyl alone, about, in the last 3 years, increased by 20%. And more recently with the COVID, it's actually increased, I think, more when we look at our data again at about 38% in the past year. A lot of it may be due to better screening. One of the things that we are dealing with from the screening component is when we do our intake, the tools that we use only allow us to ask questions for opioid use. It doesn't really specify whether if it's heroin, if it's fentanyl, if it's pills. So we had to really upgrade our screening to actually account for more fentanyl, just because we're seeing it more than coming. Significant increase, roughly about 30% in the last 3 years for young American Indian Alaska Natives, 18 to about 28. So we're seeing a lot more of that as their primary drug of choice. For the most part, I did review intakes for the last 2 weeks. 3 people were brought in. Actually, 5 people that we had brought into our facility in the last week and a half, all of them were fentanyl, primary or as a secondary. For those that are primary, it was their only drug. For where 2 of them was mainly a secondary, so they were having other substances as well. So you can see the impact on really how it's changing our demographics on who we're serving. Reason for increase is just much more, it's just more available, it's cheaper. And I think for the most part, as my clients tell me, it just has better effect. And the better effect means that, for the most part, sadly, doing an assessment 2 weeks ago, a client of mine said to me, I prefer to, this is the drug that I use, and I prefer to use it alone. Because for the most part, I've already died. So the impact, the psychological, emotional impact is already there. So the piece, and so when we're talking about, why are folks dying alone? For the most part, demographically, folks that are using fentanyl or fentanyl, in combination maybe with a stimulant, they prefer to be alone. They have left their families, they haven't had no contact with them. And so, it's the impact is there, the safety issues are pretty severe. One of the things that I just really want to cover for all of our clients that we provide services to, about 75% of our clients do meet the criteria for a mental health disorder. So that would be either depression, anxiety, PTSD. And so the impact is huge. Based on our level of care, I would say 100% have a diagnosable mental health condition. Because by the time you come to our facility, either you've had long-term incarceration that has something to do with substance abuse or possession, family issues, and also just personal health issues. Fentanyl side effects, for the most part, what we see along with stimulant or in combination is high rates of psychiatric disorders. Psychiatric disorders, when I talk about very different from mental health, is really about psychosis. Folks that are coming in having hallucination, having delusions, having paranoid, persecutory delusions, feeling that somebody's following them, having severe case of nightmares. basically, having PTSD symptoms, panic disorder, thought disorder. So 60% of our clients with opioid use disorder require comprehensive healthcare coordination, which means that we need to have psychiatry to be not just to prescribe a medication-assisted treatment, whether if it's but to provide even more comprehensive assessment, comprehensive treatment to address their condition. The history of fentanyl overdose that our clients, based on our profile, 30% of our clients had at least one overdose. So more than twice, 2 times, 55% had more than at least 2 overdoses. Several clients in the past 6 months had 5 overdoses. Steady increase in the past 3 years. I think one of the things that we're realizing from our clinical side is that the overdose becomes normalized. That it's almost normalized to the point of it's almost like a rites of passage. When we do a little focus group on how to deal with opioid, the conversation is lively, and people are having a conversation about what situation they were in. Most of the time, they were alone, and it's just a normal conversation. So that is really, to me, on my end, a very scary situation, because this is what our relatives are coming to say, that's just part of our life today. So more recently, in the last 3 months, we've had clients that are coming in who are now using Tranq, which is fentanyl also laced with lysine, which is basically a drug that's used to tranquilize non-human mammals. So if, let's say, your horse or maybe it's sick, needs to be tranquilized, go to an operation, this is the chemical they use. It is now coming into our community. So in the past, 6 months, we've seen more and more of our clients having used Tranq, and the impact is huge. Tranq, if they overdose on Tranq, naloxone doesn't work. Narcan does not work. It's not going to revive them. So it's a different kind of drug, but it also has that much more potency and it has much more impact on the brain and long term. How we came to find out, we had a client that was having a lot of wound issue. Very simple, spots on her skin, but it was really, she was feeling it to the bone. So further analysis, further comprehensive care, came out that she'd been using Tranq and was injecting. And for the most part, it does create a serious physical health condition. So it's coming into our community. So the impact of new drugs and the mixture that are coming in is quickly, and it's already here, and it's moving fast. And the impact for our community is a lot of them don't know about that. So today, a lot of accidental overdose, I think it's huge. But for our community, it's just there's very little information that's out there. So a lot of our work has really been around educating our staff and also mobilizing our own team to deal with overdose when they do happen on site. So thus far, we've had 4 overdoses. And luckily, the funding and the support that we get from SECUI, from Sierra Health, a lot of those funds were really used to educate our staff and train our staff how to use Narcan. All that, 2 of them, it was the client that jumped in because we've been training our clients and jump in. We have our Narcans hanging everywhere, administered twice. We were able to, reverse overdose on each of those occasions. Our area of where we are located is also heavily tracked by homeless, but also high use of substance use. So very often outside our door, outside our gate, we've had 2 overdoses in the last 2 months. Clients will run in and run out with a Narcan, and that's how we were able to reverse. So the impact is huge of training and also educating our clients and also our staff around the use of that. The long-term effects of, I think, fentanyl, also with tranq, is probably 30% more time, that they need to recover. But also, the amount of time that our opioid use disorder get from our staff is probably about 30% more time. We need to have more care coordination. We need to have more monitoring, a lot more system navigation to get, the treatment that they need. So areas of development to improve, I think it's really about screening and assessment, continuous quality improvement, just specifically, accessing services, information for fentanyl, continue to establish, MAT services. I think utilizing our telehealth has been huge for, even our clients. Areas of treatment development, again, telehealth. Agency staff readiness assessment, I think really a lot of it is really educating our staff, wherever they are, on all the impacts of drug. Not that the availability, not the amount of impact, but also what it does to the brain, what it does to the heart, what it does to overall health. That's really key. I think workforce development, again, just really around harm reduction. Harm reduction, to me, is just basically a continuum of our, how we treat addiction. Motivational interviewing, obviously to address the implication of historical. And I say not so historical, but it's still happening. Today, a lot of our communities, majority, probably 80% of our clients that come to us say, I need to get out of my environment. They want to get out of their own community environment because of toxicity and because of the lack of resources. So they come to urban setting like San Francisco. 80% at least of our Native people today live in urban setting. So the funding and the resources that's needed for our people in those settings is really huge. And also just continuing to address the impact of trauma. Even after they leave, one of the hardest things for us is where are they going to go when they complete our program? Because where they came from is where they left and wanted to get out of. So one of the biggest piece, I think, for, as it was mentioned, the opposite of addiction is connection. Connection, on the other hand, is the biggest part. And for this population that are using fentanyl, they want to be alone. And so part of that is developing and also really addressing that. I think one of the biggest impact that it has had on our agency is the impact on staff. For staff that have witnessed and seen the overdose was very traumatic. So, the emotional fatigue, the psychological fatigue of working with our community, and just basically burnout. So overdose response training is huge. That needs to be continued. I think overall, the needs and gaps basically increase, improve screening, assessment, testing, MAT services, and fentanyl must be screened, not just an opioid. Implement and increase Narcan training, practice include community and family. Every time we have somebody leaving, we always leave them with Narcan. And wherever we go into the community, we always bring Narcan. Support, and so I think in a lot of ways, the overdose is getting normalized, but we also want to make sure that Narcan use of that and really how to engage is also something what we need to normalize. Support and funding traditional healing and spiritual practice. For our people that when we overdose or when we should die medically, you can't just come back. We have ceremonies. We have different things as a way to address the issue, maybe whatever precipitated the situation. I think tracking overdose trends and related drug use matrix to measure impact and inform program development and change is huge. Right now, as we say, we're invisible. And I always say when we come to the county meetings that either we're really healthy or we just don't exist. But we know we do exist. And a lot of our data is being, within our Indian health data system, which does not translate to the county level. And so when we try to access funding, we have to demonstrate need. So there needs to be some level of matrix around that, develop and implement a standard overdose prevention plan for American Indian, Alaska Native. I think just really going upstream before they come to our program. I think that's kind of where a lot of the work needs to be, and a lot of collaboration. And just really advancing harm reduction to save lives, increase outreach to those most at risk is the youth, homeless, unsheltered, jail, shelter, detox. And I think for Friendship House on our end, as we always do, as an Indian people, we just do it. So we are, Friendship House is currently working on the Village San Francisco. Village San Francisco is really going to be a place where we bring our primary care, mental health, substance abuse, recovery services, youth services, all of that together to address what we can do. So thank you very much.
Thank you. Thank you so much for that. And, you know, you use the word normalized, and it's really alarming that now our people are starting to feel that that's normal for them to go through these things and to find through fentanyl a way to adapt to what's going on, not only today, but historical trauma, and for bringing out that a lot of people, another stereotype is people feel that all Indian people live on federal Indian reservations, when we know there's a high population in urban and rural communities, so the need is even greater there, so thank you for that. Our next speaker will be from the Sacramento Native American Health Center. Chief Traditional Health Officer Nathan Blacksmith has a BA in psychology and has an MA in business administration. He is an alcohol and drug abuse counselor and a certified alcohol and drug treatment executive. Mr. Blacksmith.
Thank you so much. Just want to say, Bethu Washte, Chante Nape Chiuzampelo, Nathan Blacksmith, honored to be here. So SNAC has been providing medication-assisted treatment or MAT-specific treatment services since 2020. Since the start of our program, we have provided services to 176 American Indian clients. We currently have 56 clients, 5 of which are Native enrolled in our MAT program. This program consists of prescription aid in managing opioid withdrawal symptoms and support from substance use counselors with access to a licensed clinician. The MAT team has increased their efforts to get Narcan in the hands of patients, their families, and service providers. We partner with several agencies and visit homeless encampments to provide information and offer referrals. We provide Narcan training that is open to the community and provide training for organizations upon request. We have a relationship with UC Davis Emergency Department that provides patient referrals to our clinic and support with inductions. Many patients have benefited from this as they have immediate access to treatment support following their release from ER. The California Consortium of Urban Indian Health has provided booklets with cultural specific education on opioid overdose and Narcan administration. As SNAC, we're working on a culturally tailored response. We talked a lot about the various issues that kind of fall under the umbrella of the fentanyl crisis, and one of the solutions that we're focused on is the traditional health focus, which in essence means the inclusion of ceremony in the recovery of this fentanyl. So we want to as well address all of the other underlying issues, but as well offer spiritual help, spiritual guidance, and really a connection to reestablish. As a people, we're spiritual since the beginning, and that's something that we can't neglect when these relatives come to our doors for help. So thank you so much for your time.
Thank you so much for that. And for the Sacramento Native American Health Center, that's actually right here in Sacramento, for the different services that you provide and for the insight into what's going on right around us within this capital. Our next speaker is from the Kimyai Medical Center, Hoopa, Behavioral Health Director Boyd Ferris. Ferris is a citizen of the Hoopa tribe and has served his community at Kimyai since 2012. He is an alcohol and drug counselor. Mr. Ferris.
Thank you. Honored to be here. Heyong Kale Wamalio Aholiat Boyd Ferris. I'm from the Hoopa Valley Indian Reservation, a Hoopa tribal member, a descendant of the Yurok and Karuk people, Chippewa. Our reservation is about 5.5 hours from here. It's seated in Humboldt County. It's the Hoopa Valley Indian Reservation We have Kamau Medical Center, which is entrusted to provide services there for medical, dental, has an ambulance base, and then behavioral health. We have a population of about 3,400 people, of which a little over 1,900 of those are Hoopa members, another 1,000 of other Indians. As we said, we're our neighbors, the Yurok and Karuk people, inhabit that beautiful valley. We provide services to all of that community up and down the river. And as far as behavioral health services, we provide mental health services for anxiety, depression, couples counseling. For substance abuse services, we provide outpatient services 5 days a week and referrals to detox and residential treatment. As I said, we're very isolated. We're about a 45 to 60 mile drive from the nearest urgent care hospital, which is in Arcata and Eureka, California. We have access to 2 detoxification centers, one in Eureka, California at Waterfront Recovery Services, and then one in Redding, California, which is about a 2-hour and 15-minute drive from our valley. So with being, isolated like that, as many people have testified earlier today, a lot of times response is few and far between. Our ambulance many times is on a run, whether going to pick up somebody or take somebody. So same with our sheriffs, where we get care from our oversight from the Humboldt County Sheriff's Department as well as the Hoopa Tribal Police Department. But members of those groups many times are on the run. I spoke to our ambulance driver, one of the main directors, and over the course of the last year, he reported that we've had 97 calls, of which 57 were for overdose. Speaking, more recently as a result of fentanyl, about 3 weeks ago, he was given information from the local, the nearby ambulance departments that there's somebody up that we transport home. So that's what it looks like in our community, for a behavioral health director, for a substance abuse counselor, is sometimes we're social workers, sometimes we're substance abuse counselors, sometimes we're just there to, sit with a parent who lost a loved one. So as it relates to age within our community, these drugs, they do not discriminate. We're seeing it start to affect people at a younger age. As people were saying earlier, that age group was confirmed by our ambulance director. The age group of 20 to 45 seems to be, out of those 57 overdoses, primarily over 75% of those in that age group. However, within the last 3 to 4 months, he's seen that 13 to 16-year-olds are also starting to respond to this age group. One thing that I fully embrace the harm reduction strategies and Narcan and naloxone in our communities. Those we're grateful to our partners, Abby and the Wellness Court. They come onto the reservation and they provide a lot of training and dispersal of Narcan. Our partners through Humboldt County come, and then ourselves. We have a medication-assisted treatment program through our clinic as well. It's been in operation since 2018, and they have about 57 members that they're providing care for. The one thing that I've noticed and have heard within our community is that these children, our children in our schools, are starting to have some false security around Narcan, because they will go as a group and they'll get some Narcan, and then they'll knowing the dangers of these drugs, they'll go and still utilize these drugs, but with Narcan. The one thing that, it's a false, excuse me?
No, it was just, I just reacted to,
Oh.
because they have Narcan, now it's a false security, and they're partaking in fentanyl because they figure if they do that, they have Narcan.
They have something to help
someone else
reverse
to
it.
bring them back.
Right.
Wow, yeah.
The,
Sorry about that.
and then, I guess as a part of that, our ambulance director had said that the potency of the fentanyl is getting stronger. I think part of that is, as Nelson was talking about with the xylazine and the tranquilizer, it's non-opiate, so it doesn't bind to the receptors in the brain, so therefore it doesn't respond to Narcan. And so rescue breathing is what has to be done for those people that, if it's cut with that. We're currently finding that, as Greg said earlier, that a lot of times when they're showing up to an overdose, they're, administering the first Narcan, and then maybe if an ambulance shows up, what Rod, our manager, said is they're having to do an additional 2 to 3 more administrations of Narcan. And so what they've started to do is make sure that they can get the injectable Narcan and get a line going ASAP, because that seems to help as well. So, like we've heard all of the information in regards to this in our communities about fentanyl, about the problems. I think that one thing I always feel like in our community is that we're just rushing around putting fires out. We don't have the needed facilities, as Abby spoke about, with detox and a regional center for our people, I think would be what is definitely needed and will help. So that's one of the asks. I know that we have to continue getting into the schools. It seems like we know we have to get upstream and start providing this prevention, but it's not our reality. It's just we have to run from one overdose to the next, or we always have these emergencies that we have to respond to, and sooner or later, hopefully with funding and the right appropriation, we can get upstream and start providing the comprehensive education and prevention to our schools that's needed, the healing for our families due to trauma. I know also I'll end with a personal story with regards to what it looks like for many of our families. I help raise, with my wife and I, we help raise our nieces. 2 of my sister-in-laws continue to struggle with the disease of addiction, and many times we sit there and we look at our nieces' faces, and judging by the anxiety that we feel from them, at any given time, it could be a reality that they find their parents. And so, grandparents raising their children's kids, and aunts and uncles stepping in to raise children. We need help. We need help to combat this fentanyl and the disease of addiction. So I want to thank you guys for having this panel, this roundtable, and for allowing all of us to bring this forward. So thank you.
Well, thank you so much for the testimony and bringing awareness to the legislator. I'll come back now to the dais if there's any comments or questions from members. Member Guarcuri?
There is a brand new, I live in Yolo County, a brand new facility that's tribal run for addiction. And from my understanding, I went and toured it, and it's really very state of the art. I think it has 30 beds, maybe more, gymnasium. It's got, but they had a hard time finding people to work there that understood the tribal issues. And so it was sitting there vacant for quite some time. Now it looks like it's up and running full time. Obviously, they have figured out the workforce there. But I wish I could remember. I want to say it's called Healing Hands, but I can't remember the name of it. But it's brand new, and it's just for tribal. And they bring the young people, and my understanding they're mostly juveniles that they're bringing there, and then they have wraparound services on site. So I have one in my community. I don't know enough about it, but maybe I can take Assemblymember Ramos out to see it. I don't know if you've been out there yet. It's brand new. It's really nice.
Sacred Oaks?
That might be it.
Yeah, IHS.
Well, it's IHS, Indian Health Service.
Yeah, and it's really nice. I don't know everything about it, but I will say it's not tribal.
It's not tribally run, it's run by the federal government, the Indian Health Service.
Is it? It's whatever. It's really nice, and so I mean, we'll take any steps that we can. I mean, that's what it is.
I think one of the challenge with them is they just require only a substance use disorder and no mental health issues. That's where, you know,
Well, we need to
the
fix
lack
that.
of understanding around the issues of mental health that's really associated with addiction.
Okay, well, good to know. I mean, you know, at least I know that. The last one is I just recently heard a podcast. I love podcasts. May be good for me or not. But Cherokee Nation in Oklahoma has spent $100 million on a brand new facility that they're doing for opiates. Am I right or am I wrong? And I don't know how far they've done so far, but I don't know if it might be something, a pilot or something, we could do something similar in California. Anyway, those are my comments.
Thank you so much for that. And Indian Health Service ran by the federal government, we could take some best practices and adopt those into the state of California. I just want to thank everyone for taking the time to be here, and the members taking time out of their schedule to be here and hear firsthand from the Indian community. I know it's been a day, but you know, we have to be able to continue to work together and taking away, you know, the feeling of being invisible. Invisible when you're going through some of these challenges in life. And then if someone succumbs to it, feeling that they're still invisible and we're not addressing the issue, that's something that we should really take heart of here at the state legislature. But also the healing. We talked about historical trauma and the trauma that still is impacting our people, but are we doing enough to heal the home, to heal our tribal communities for someone could come back home and be back around family? And certainly when we hear about transportation and having detox centers and then having to go from a reservation up in Hoopa or other parts of the state of California and go to Tule River that has a center, or down into San Francisco, those are far areas. We have to do a better job at looking at the infrastructure and opening it up to the Native American community here in the state of California. So I want to thank you all the presenters, for being able to bring this voice forward. And it is your voice that's needed around the table. And so I want to thank you for taking the time to be here and share on the mic. All these things were recorded, so then we could actually share it with other legislators out there. Thank you so much. That concludes this roundtable.